when I hear your story, you're a popular person at the conferences at UKIO. Everyone goes around you and your wheelchair, and we all know you. And I don't call it a disability; I call it a different ability. But to hear your story of your personal life journey with your husband and your business, and you're still pushing on with your work and your research, then to get sarcoma, to lose your leg. I mean, the list can go on in terms of all the challenges you face. And it was, I'm sure it was, at points you said you were feeling suicidal and you're ready to give up. Somewhere out there is going to be someone probably going through the same things as you had been through, um, because the world is unfair. There is going to be a doctor or a radiographer or a healthcare professional facing the same issues. What can you tell them that, based on what you've been through, or what can you share with them?
That's a difficult question, because I think one of the aspects of the work that I did with the Cushing's patients was they're all individuals, different backgrounds, different cultures actually as well. And I think that it depends on the individual, but I think you've got to face it full on. It's not easy to face it full on. It's easy to shy away from it and not want to think about it. I think talking to somebody that really understands your unmet needs, and that's difficult when you maybe go to your consultant appointment. I mean, I seem to live in the hospital as well, because I get follow-ups all the time, as you could imagine. I have a yearly endocrinology, neurology and so on. And you only get 10 minutes. You have to be prepared before you go in to what you want to ask that clinician, because that way, and I wrote a paper quite recently on listen to the patient's voice, because that's the best tool in a physician's toolbox.
Absolutely.
Is the patient's voice. And I always said to the Cushing's patients I was working with that be prepared to go in. I don't like to ask about this, I'm embarrassed to ask, and so on. Because some of the conditions that some of the patients had really did have very sexual orientated problems and things that people don't really like to talk about to their physicians.
Of course.
Yeah. What I've always felt about my students, and I've had a lot of students over the years, is that please come to me. If you've got it, let's talk about it. Can't be that part. Let's have a chat. What is it? And sometimes it can be a personal one they don't want to speak about, that's really causing them to have a problem with their studies and so on. But it's that human touch that is required. You can do all the certificates that you want to do, but to me, if you're working in health, then you have to have that human touch, that hand to reach out, and that ability to understand. And I think that when you have a lot of experiences like I have, and I'm sure many of my colleagues in radiography and radiology, they bring your own life's experiences to it. And I did find that when I developed the assistant practitioner course in Scotland, I was particularly passionate about that, because that's where I started, really, in the dark room. And on the reception desk. And that to me was yesterday's assistant practitioner. And these people that usually come on assistant practitioners, certainly in the AP course that I managed, they were mainly all mature students, and they were so pleased to get a second chance. A lot of them had been support workers within the healthcare, but they had their second chance, and they worked so hard, and they were so good with their patients, and that was because their life experiences you could see that mature touch. And that comes to the undergraduates, but it takes time when you're qualifying at 19, 20, you're very young. But if you've got good mentors, good practice educators, that is where the true knowledge comes. When you're out there with a good practice educator and they're frank with you, they're honest with you, and if that person does the job right, then they're showing that care to their patients. And that makes a difference as well, I think.